Some of the most common foods that people are allergic to are peanuts and shellfish. In one particular class, there was a little boy with a peanut allergy. And it was so bad that when his classmate brought a peanut butter and jelly sandwich to school, the boy had severe urticaria, itching his face all over. His neighbor grew more and more concerned as the boy started itching his neck and face, and wheals appeared all over his body. The raised bumps spread very quickly. When he called for his teacher, she noticed erythema all over the boy. He was as red as a lobster. At a first glance, she thought that it was varicella. It is highly contagious, and the chickenpox had been going around that year. But then she smelled the sandwich and knew it was an allergic reaction. At the hospital, the doctors ran lots of tests and poked and prodded the boy all over. He glanced at their notes as he itched at his arms and saw written in the symptoms, pruritus, as he continued to scratch ferociously at his wheals. The nurses examined the boy all over, noting every macule and freckle. Macule! 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 In fact, the boy had a light brown macule on his arm that he had had since birth. The doctor also noticed a nevus. The mark was raised and asymmetrical, and the doctor said they would have to use a needle to get a sample of it to do a biopsy, just to be sure that it was not cancer. The boy was getting very nervous at this point. He had to wait a long time, but then the doctor came back and told him that it was not basal cell carcinoma, but reminded him the importance of always wearing sunscreen.